Good evening, everyone. I hope everyone is being able to join us and getting connected in. My name is Mary Fowler. I am from the class of 1998 and the current president of the MU Medical Alumni Organization. I'd like to welcome all of you to the 63rd Annual Physicians Alumni Weekend, the virtual edition. We are used to seeing each year hundreds of alumni return to campus and catch up with fellow alumni and celebrate reunions and reconnect with faculty and see all the changes to the medical school. Unfortunately, 2020 has required us to adapt to a new normal that I have yet to find quite normal in our personal and professional lives, as ongoing concerns for safety, individual comfort, and community guidelines have changed how we work, travel, and celebrate. Many programs over the past 6 to 7 months have been canceled, postponed, or moved to a similar virtual format, and we are becoming experts at Zooming. I am still disappointed to not be able to talk with you at our reunion banquet, but I am pleased that we are able to provide an update about our school and celebrate our reunion classes virtually this evening. I would like to very briefly recognize our reunion classes who will be having class Zoom reunions later this evening. The class of 1960 celebrates its 60th reunion. The class of 1965 has a 55-year reunion with Dr. Andrew Gallicados as the class agent. The class of 1970 is celebrating their golden anniversary, their 50th reunion, with their class agent, Peter Hayden. The class of 1975 has a 45th reunion. The class of 1980 and their 40th reunion with their class agent, Dr. Susan Even. The class of 1985 has a class agent of Dr. Susie Ayler, and they're celebrating their 35th reunion. The class of 1990 celebrating their 30th reunion with class agent Dr. Chris Maloney. The class of 1995 has a 25th reunion with their class agent being Dr. Greg Schneider. The class of 2000 is celebrating their 20th reunion. Their class agent is Dr. Dawn Davis. The class of 2005 is celebrating a 15-year reunion, with their class agent being Dr. Jason Smith. And finally, the class of 2010 is celebrating a 10th reunion. Class agent is Dr. Ted Thomas. Fellow alumni, I encourage you to attend these reunions if they apply to you. And I encourage you to seek out other opportunities in this challenging year to engage with Mizzou Med, whether this is through volunteering as a mentor, serving on the alumni board or advisory committee, making a contribution to a scholarship program, or joining the Mizzou Alumni Association. Alumni support makes a vital impact for the School of Medicine. It makes me proud that the generosity of our medical alumni and donors allows the school to award more than 1.5 million in scholarships annually to our medical students. And each incoming student is presented with an MU branded white coat and stethoscope. I again this year had the wonderful opportunity to welcome the new class of students, the class of 2024, over the summer. Seeing 128 students socially distant in Jesse Auditorium, which was about the only place that could hold all of us on campus, was both sad and encouraging. I missed the intimate breakfast and conversations that this program usually provides us. I was disappointed that I didn't get to see students going to hang out with their friends at the Heidelberg for a beer after the formal affairs to decompress the day's agenda. But I was encouraged that despite being in the midst of a global pandemic, and adapted educational experiences, those 128 students were happy to be there and prepared to face the challenge. The future is very bright. Now it is my great pleasure to introduce Dr. Stephen Zweig, class of 1979, Hugh E. and Sarah D. Stevenson, Dean of the MU School of Medicine and Professor of Family Medicine. Dean Zweig joined the MU faculty in 1984 and has served in numerous leadership roles, including the Jack M. Caldwell and Winifred S. Caldwell Endowed Chair of Family Medicine, and directing the MU Interdisciplinary Center on Aging. Dr. Zweig is a family physician with additional certifications in geriatric medicine and hospice and palliative medicine. And I think at this point, I can call him a friend as well. Dr. Zweig.
Thanks so much, Mary. It's really great to be here, and thank you for your tireless support of our alums and our students. This is, I think, at least your third virtual event this year in your role as president, and we really appreciate it. So Rick Barron and I think maybe among the few who are in Columbia today, and it's a beautiful fall day here. You didn't miss a football game either, so but there were a bunch of kids painting on the windows on 9th Street to try to get into the spirit of the homecoming. So we miss you all. My job tonight is to give you a rundown on the medical school. I think you will also be able to ask, I've tried to address the questions that were sent in ahead of time. I think you'll also be able to post some questions, and Mary can interrupt me, or we can do questions after Dr. Barron's done speaking. So Ben, if you put my slides up for me. So first of all, I want to introduce Dr. Rick Barron, who's going to be our next speaker. Rick has just been a tremendous source of energy and talent since he's joined us in May. He was the executive vice chancellor for research at KU and fills two roles here as executive vice chancellor for health affairs, a position that hasn't been filled for the last 5 years or so, and also the scientific director for NextGen Precision Health, which is a great new research facility that he's going to get a chance to tell you about a little bit later. So Rick, in his welcome speech here at MU, said his approach is stability, service, safety, and success. And I think he really lives up to that mantra, and it's been a great joy for me to work with him. So here's an update on the current class of 2024. So these are our first year students. You can see that this is a very talented class. I know my GPA was not 3.8 on admission. We interviewed 400 students out of over 3,000 applicants, accepted 191 for now a class of 128, which is fully enlarged to its maximum given the Springfield clinical campus coming online. About 85% of our students come from Missouri. That's actually very specific. What is not is that 21% of them come from rural parts of our state, and 17% self-identify as underrepresented minorities. And for the last 5 years, we've done a much better in terms of our ability to make our class as diverse as the community around us. And now you can also see that over half of our students are women, and that's been true for the last few years. Next slide, please, Ben. Mary told you about what the white coat ceremony was like this year. Here's 128 students filling Jesse Hall, and that's about what it takes. And so you can imagine the challenges of us running a curriculum given the current sort of geographic structure of the buildings that we have. The next couple of slides are just great examples, I think, of the students that we have and their commitment and seriousness upon which that they take on their roles as students. So you can see they both wrote these comments during the Y Code ceremony. And I think appropriately taking on the seriousness of the event, it just goes to it just shows you what a neat group of young people that we have here on campus. Next slide, please. The effects of the pandemic have been substantial in our curriculum. We shut everything down in late March, sent everybody home, created both an online curriculum for the first and second year students and the clinical students. And we were able to invite them back in May, which was much sooner than they came back in many medical schools across the country. Like all other schools, we suffered huge losses of revenue from the clinical work that we do, but also a tremendous loss in revenue from the state and the campus because of the lost tax revenue. And the amazing thing is that we made all of that up through about 3 months of budget cuts and then a lot of other cuts and tremendous amount of work to restore the clinical effort after we came back in. The first years now occupy the PBL labs to accommodate spacing. This next block, we're going to do a rotation. So both the first and second years will have some opportunity to be in the labs. We're not allowing medical students to participate in the care of patients who are suspected or known to have COVID infection. Some of the medical schools in the East got so overwhelmed with cases that medical students were definitely brought into the fray. We've been able to avoid that. We've also followed AAMC guidelines and made all away rotations go away except for those which we cannot provide. And that's been a standard around the country. And in fact, this fall, all interviews for residency will be by Zoom, and there'll be no traveling of our students from one school to another. So the good news is that we suffered much less than many medical schools, and our students, faculty, and staff just responded amazingly well. It was a difficult challenge to create a new curriculum, to learn in different ways, to provide patient care in different ways, but we were able to do that. And I think going forward, it's pretty clear that we're going to need to operate within the limits of this COVID pandemic and continue to do our work. There were some questions about medical student tuition. So I wanted to show you where we are here compared to other schools that surround us. We've been on a course to increase our tuition 8% per year, starting in fiscal 19. This year, we decided to hold back on increasing the tuition because of all the turmoil. But you see that even when we're totally done with our 3 increases, we'll be right in the middle of our contiguous state medical schools and quite a bit below private medical schools, but with a tuition rate of close to $40,000 a year for in-state students. And the next slide shows you something about student debt. This was another question. You know, our student debt currently is about $180,000 on average after 4 years of medical school. Some of that will include debt that's acquired during the undergraduate years. But this slide shows that the average cost of a private medical school is the blue line, of a public medical school, the green dotted line, and then the average amount of debt in both a private school and a public school. So we're a little better than the typical public school, but compared to the debt that most of us had, this is quite dramatic. This just gives you a little bit about the match from 2020. Obviously, these pictures are not from 2020. These are 2019 pictures because our match was entirely virtual this year. But our students were very successful in matching. About a fifth of them will stay here for residency, a third will stay in Missouri. And you can see that a variety of them pick sort of the common programs that are entry into primary care. and all other specialties are well represented in our class. Just want to give you a little update on the Springfield clinical campus. We've hired a new associate dean. This is David Haustein, who is a graduate of MU, went through the problem-based learning curriculum, did his residency in physical medicine and rehabilitation here, and then has been a faculty at the University of Louisville for the past 10 years or so, and been very much involved in education there in terms of their own problem-based learning curriculum, and a very strong interest in skill and residency placement. And he just started a month ago, has dug in and is doing a great job. And I just want to thank so many of the people who contributed to our early success in Springfield. Mark Haustein, one of our MU grads, I think class of 1980 maybe, or close, has been the interim associate dean, has done a tremendous job recruiting hundreds of volunteer faculty in Springfield. He works on the Cox side. Dave Barb, class of 80, works on the Mercy side. And those guys have helped us to recruit people at both of those hospital systems, as well as Compass Jordan Valley Community Health Center. We've hired part-time associate clerkship directors in Springfield who help us to run the third-year clerkships. We have a staff and a facility there. But this has really been a tremendous community effort and has so far been a great success. Also want to just note that all the volunteer physician preceptors and communities that help to serve our rural training track and teach our medical students in those communities. This next slide just tells you a little bit about the Springfield Clinical Campus. First class was 8 in 2015, and now we're up to the full complement of 32 students in each class. Someone asked about, is there other residency training in Springfield? The only program currently is a family medicine residency at Cox that's been there for probably 25 or so years. None others yet. They have created a new patient care learning center at Springfield. So a lot of, to be done in that environment. Our students do quite well. They're doing just as well as our own students, or better in terms of the STEP scores, and their own self-assessment of their learning there has been extremely positive. Next slide just talks a little bit about how we responded within our practices to the pandemic, as all of you did. You know, we went from 1,900 telehealth visits were the ones where they're done with within a clinic setting, to 51,000 telehealth visits from doctor to home during the period between March and June. And we created virtual assessments for people who might be sick, drive-through testing, a great triage system. Our teams in the hospital basically cared for COVID patients in separate environments, as they're currently doing. Pathology has created some innovative approaches to testing, and we've really tried to use this as an opportunity to communicate more frequently and effectively with all of our staff, just due to the incredibly increase in risk and ambiguity associated with this pandemic. And so the good news is that we now have learned a lot about telehealth, and I think there's tremendous number of opportunities to include this sort of virtual visits in combination with in-person visits for many of our rural communities. The next slide just shows how we've grown tremendously clinically over the past 7 years. We now have over 600 full-time faculty physicians working at MU. Still, pretty much all the clinical work is done by faculty. We have a few doctors in private practice who participate in our hospital system, but not many. And so this has been a big piece of the action that we have here at the medical school. The next slide is really changing to now a focus on research. We really are looking at issues of how to train people, but also to attract new talent. We found that we have to work even harder at creating collaborative relationships with clinicians and basic scientists. that we have to translate the basic science work into through animal models and clinical trials and population interventions that will impact people. And we recognize a tremendous need to grow our clinical research and our clinical trials programs at the university. The amount of infrastructure that we're working on at the dean's office level to help to support this research is substantial and is really going to be helpful to us. The next slide shows that we've already made some gains in the past year. Our NIH dollars went up 26%. What was called phase 2 AAU dollars increased by 65%. Most of that's clinical trials, still far less than we aspire to. And so we actually had a pretty good year in terms of our growth in it, and that bodes well that we also have more awards going forward. This is an area we're working on quite substantially, and Dr. Barron's helping tremendously in this area. I want to just give you a few examples of the kind of work that's going on. Kathleen Quinn still leads our rural health programs and education of our students in rural communities, and she's been very successful in getting money from HRSA to help to support these programs. And you know, we've the Rural Track Pipeline that started with Dr. Williamson and that she has run with Dr. Stevemer and over the last several years, and now Dr. Morris, has been a really successful program. The students that we link into the program start in their second year of college. They're all from small towns in Missouri. And eventually, once you get out through medical school and residency, over 50% of them practice in rural communities in Missouri. So it's really had quite a significant impact, even though we're way below what we need in many of those communities. The next slide is just an example of some of our new research recruits. These are both men that have done a lot of work in the basic science world. Dr. Chen is in the surgery department, looks at inflammatory mechanisms that relate to aortic aneurysms, has been successful in getting funding from the NIH. And Henry Wan, who came from University of Mississippi, has just been a grant writing machine and helps to lead our influenza research center and is doing work not only on the structure of influenza, but the immunization and transmission aspects, and collaborating with a wide number of people on our campus. Two other really important figures that are going to be part of the dean's office to help to advance our research are Russ Waitman, who was at the University of Kansas and is the organizer of what's called the Great Plains Collaborative, which is a network of academic health centers and their electronic health records. And he's just been a star at both collaborating across the country and helping physicians access EHR data to do clinical research. And the next new faculty member and also a member of the dean's office staff is Dr. Jillian Bartlett, who has come from McGill. She's an epidemiologist with tremendous amount of different types of research talents to help us, particularly in outcomes and population health research. Just a couple of other highlights. Our faculty haven't been sleeping during the COVID pandemic. They've published over 75 now peer-reviewed research articles on COVID, even though most of us had never heard of it before January. Family and community medicine is still and consistently ranked among the top 10 departments in the country by U.S. News and World Report. And their department chair, Mike Lefevre, is doing a great job. I'm just going to show you one slide on finances. When most of you went to medical school here, this slide looks dramatically different than it does now. This gives you a sense of our financials. You can see that most of our budget comes from clinical revenue generated by our faculty, physicians, and the health system. So if you add up clinical revenue, MUHC, and school UP trust, those are all dollars that come from clinical revenue. It's about 70% of the total budget of the medical school. Now, the rest primarily comes from research dollars, the campus, and philanthropy. It's probably important to know that only about 8% of our budget now comes from the total of tuition from the medical students and state dollars that go through the university. Next slide, please. I just want to go over some of the things that we're really going to be striving to do during the next year. On the clinical side, we will continue to advance our clinical mission, and we understand that our commitment is really to the rural communities that surround us. We know that we will continue to grow in primary care, cancer care, cardiovascular, neurosciences, and children's health services, because those are really the needs in our service area. We're going to continue to build infrastructure to support our research growth and advance not only biomedical research, but also translational research in informatics, clinical trials, and population health. And those are all in line with the precision health program, which you're going to hear about when Dr. Barron speaks. We know that because of such limited money that's now coming from the campus, that we have some real issues that we're going to have to address with regard to our basic science departments. We also know that we have to continue to innovate with regard to our educational programs to advance our mission. And that means both in the undergraduate education and the GME programs. And then it's really important that we address the human beings that work in our environment. We strive to reduce bias and racism in our curriculum, in our selection of students and trainees, in our hiring and promotion processes, in the experience of our employees who work here, and in the care that we provide our patients. This is a real and historical phenomenon, and we have to keep working to make it better. We also really are striving to create and sustain fair and efficient and accountable processes for all the things that we do in the medical school, which includes compensation of faculty, human resources, space allocation, business organization, and finance. We also know that we have to establish new strategies for growing and sustaining faculty and staff engagement. This is a particularly difficult time, and we have to engage our people who are feeling beat up. And as you know, there was already a growing sense of burnout before the pandemic started. And then we have to really focus on leadership development, because good leaders are what make things happen. And we're not satisfied with where we are. We know we need to change and continue to get better. We recognize that with a limited amount of money coming from the state and the campus, and that research and education are inadequately supported, we have to work with our stakeholders to build new levels of philanthropic support. And that's a hard thing for a state university to talk about, and we've only been in that business for about 25 years. However, the university just completed its development campaign and was able to get donations worth $1.4 billion over the last 8 years of that campaign. Finally, we know that if we don't measure sources of success, we're not going to be able to drive that success. So we're working to create the types of dashboards at the departmental and school level that will help to advance our service and quality, engagement, growth, and stewardship. So where are we heading for the future? Clearly, we need to sustain excellence and innovation. And we have to really create an academic health system with MU Healthcare and MU Campus. And we've been working on that in the past year, and that process has accelerated since Dr. Barron has come. But we also have to do this within the limits of our global pandemic. We have to make sure that we have superior medical education, advanced patient care, and growth in research through a shared strategic plan. We know that over time, at least the proportion of dollars that we get from the state will be reduced. We're certainly striving to keep our tuition comparable to surrounding state medical schools. We're committed to keeping our people safe and healthy. And we want to support our mission, our combined mission, to save and improve lives through exemplary education, research, and patient care. So our alums commonly ask how they can help. Certainly the influence that you provide, the advice and support to us, the partnership that you often create with our students by inviting them into your communities is incredibly important. But just talking about the importance of the School of Medicine, the impact it had on you, and within your community is a tremendous help. Missouri, University of Missouri grads still represent the most significant medical school contribution in the state of Missouri. So we are the doctors in Missouri. Certainly can continue or start becoming a donor, encouraging others to be supportive. We need help with education and research that are always underfunded. The precision health, NextGen precision health is a really important activity that's going to affect us into the distant future. And of course, student scholarships. Over 3,600 School of Medicine alumni contributed to the last campaign. And that's just really remarkable. So I'll just end by saying thank you. Thank you very much. It's been great to be with you. I wish I could see you in person. I hope you come next year. I will certainly strive to be here, and we'll have a much greater time here in Columbia. And I think that I'm going to now pass you on to Dr. Barron. And unless, Mary, do you wanted to bring up any questions at this point or on the chat?
The chat has been very quiet from what I've seen. So you must have answered all the questions, Dr. Zweig. So
Well,
if anyone does have questions, please chime in and we can interrupt both Dr. Zweig and Dr. Barron to address your questions as needed.
And I know that Ben just posted on the chat the link to the YouTube video of the Oath of Geneva if you're interested in watching. Yeah, and so I'll just pass the baton to my boss, Dr. Rick Barron, Executive Vice Chancellor for Health Affairs at University of Missouri. Rick?
Thanks, Steve. And thank you, alumni, Steve and Mary, for inviting me to part of your alumni event tonight. As Steve said, I arrived in March. A little bit about myself. I grew up in St. Louis, like Steve, just not too far from Steve and close to where Mary works now. And I went to University of Missouri, Kansas City Med School, the other state med school in Missouri. So that I was a kangaroo then, but now I am a tiger. So I've decided we have a new species called tigeroo, and that's what I am now. So Steve, the way Steve and I decided to split this up, he was going to talk mainly about School of Medicine, and I was going to talk mainly about MU Health System and the NextGen Institute. So, you know, all of you recognize University Hospital, but MU keeps growing. MU Health System keeps growing. Of course, you now have Missouri Orthopedic Institute on the central campus, Ellis Fischel Cancer Center, the new building. We've absorbed Missouri Psychiatric Center, and then Women's and Children's is a couple miles away. And we have a huge number of ambulatory services around the community. And one of the newest buildings is on Providence, close to where I live, and a new one's going to be opening up in North Columbia soon. I have a picture of Camp Regional Medical Center here in Jeff City, and you can go to the next slide because it mentions it there too. And Camp Region has really become almost more than an affiliate. It's become almost part of MUHC, and we're actually moving toward having a relationship with Camp Region that's very, very tight, and it makes sense for both hospitals. So that's going on. Of course, you know, we have this very tight collaboration with Cerner, the Tiger Institute, which is just an amazing way that a big industry partner collaborates with the university. And then we have very healthy relationships with Siemens, Roche. A new one is going to be announced with regard to Novartis, Thermo Fisher. And then, of course, the Rehabilitation Hospital in Columbia Rush is a joint partnership with University of Missouri. Uh, the amount of partnerships that I've witnessed since I've been here the last few months is astonishing. And, you know, I was on loan to the state of Kansas for the last 20 years at KU Medical Center, and I've never seen any of this degree of partnerships or mature partnerships. And so it's a great says a lot about University of Missouri that we can develop these. Next slide. So this is hot off the presses. You know, as the EVC of Health Affairs, I work with Steve as the dean. I work with Jonathan Curtright as the CEO of the hospital. And the School of Medicine and MUHC combined is an entity called MU Health that actually also includes School of Health Professions and School of Nursing. So we had a retreat the other day, and for the last year or two, the strategic planning process has been in place, and each of those units had developed different strategic plans and different mission, slightly different mission, vision, and value statement. They were very close, but they were all a little bit different. So we actually had an amazing retreat where we had leaders from all of these units, and we all agreed on this. So this is now the mission, the vision, and the values statement for MU Health. We did a lot of wordsmithing on this. The mission to save and improve lives through exemplary education, research, and patient care. The vision, we will be the premier and transformational integrated academic health system for Missouri. There's a lot packed in there, which if you want to talk about it in Q&A, we can. And then on values, we now have diversity, inclusion, and equity, respect, service, and responsibility. And so this is our mission, vision, and value statement. And now we are, all the units are working on their operational tactics plan for the healthcare system, for the School of Medicine, for the School of HP, and School of Nursing. So it's very exciting. Steve showed numbers about the School of Medicine. This is the numbers about MUH system. It's a big medical system. You can see with 690,000 clinic visits a year, 2,510 births a year, and then we also have almost 7,000. It probably is 7,000 by now. Employees of MU Health System. So we are a big village. Next slide. This is pictures of COVID since May and all the stuff that we've had to stand up. Of course, the drive-through testing, which has been an enormous service to Columbia. Oh, that's my granddaughter saying, "Hi, honey, I'm busy." We about 600 to 700 drive-throughs a day go through the Ellis Fischel facility to get COVID testing. We set up an incident in command. Initially, it met twice a day, 7 days a week. It's slowed down now to once a day, 5 days a week, but still pretty busy. We had to set up new daycare facilities. We got community involvement in making masks. We had to put plastic all over the place. And this is just some nice pictures of that. Next slide. So then in September, all the students came back, not just the med students, all the students came back. So President Choi and Provost Ramchan made a brave decision and a rational decision to let students back on campus, taking enormous precautions. I can tell you, because I attend Dr. Choi's morning COVID briefing every day, it's working. Now we're all holding our breath and hoping that it still continues to work. But while the number of COVID cases continue to rise, and clearly nationally and worldwide, we're seeing a bit of an uptick now. We all know that's going on in the fall. The number of student cases that are every day is less than 10 consistently for the last several weeks, whereas initially it was around 150 a day. And when it was 150 a day, we actually opened up 2 drive-through locations, and now we're back down to 1. We established a new student health center, and we started partnering with the county health district to share resources for contact tracers. Next slide. This is just some bragging points about the MU healthcare system and the way we're able to help support our academic mission. We really do a great job on patient satisfaction among looking at 2 different ranking systems. A Vizient ranking, we went from 45th to 23rd this year, which is incredible. We got 4-star ranking for hospital patient satisfaction for Medicare and Medicaid. And we've been profitable, even with COVID, where we did take a financial dip for a couple of months. We had been doing so well up till then, and we did so well in June that we ended up having a $65 million net operating income. And that's after we were able to do the support in the following areas. The healthcare system is supporting NextGen to a tune of about $20 million, supporting the School of Medicine for in-kind services that Dr. Zweig uses to support his faculty, another $58 million. We were able to give money to the School of Health Professions, and we're able to give bricks and mortar money for the School of Nursing, which is building a new building. So we've been very, very fortunate at MU Health system in our financial picture this year, and we've been able to continue to provide support for our mission. Next slide. So now I'm going to transition. So this artist rendition of this amazing structure, which is going up now just east of the Ellis Fischel building, is the NextGen Precision Health building. This has been in planning for a while, even before President Choi got on campus, and he's been here a few years. I think this has been in planning for 6 or 7 years, but it really took President Choi to push it over the top and get it to really happen and get shovels in the ground. And then after he hired me to be the EVC of Health Affairs, he asked me if I would be the executive scientific director for this amazing building and what's going to go on inside it. Next slide. So I've been working on this slide for a while to try to explain precision health and what we're doing, not just in the building, but throughout the MU university system. Precision health is getting the right intervention to the right person at the right time. And how do you do that? Well, you have to do a genes to generation or cells to society approach. We have to look at the genome. We have to be able to find defects that occur in various diseases. And now we have gene therapy is at hand, and we're doing this for a number of diseases. We have to look at the cell level. And in this new building, we have a state-of-the-art Thermo Fisher electron microscopy center to understand disease mechanisms. We look at the whole organ, and in this building, we have a 7T MRI, the only one in the state, and a CT PET scan, and to look at, again, to look at the organ level. And then you put it all together, and we're going to do research with the permission of our patients that are in the healthcare system, work on targeted drug delivery and personalized medicine. And then finally, we want to look at the community, particularly rural community, but also the underserved community that are not necessarily rural, to try to improve health in that personalized environment. So in this building, we believe we're going to be able to have the basic scientists, animal models. We have a new state-of-the-art clinical translational science unit we're building for research subjects, and then hopefully some of the drugs and projects that our investigators will be working on with industry will get to market. Next slide. So we can't do everything, even though it sounds like on that last slide I'm saying we can, but we have to take a targeted approach. So the areas of focus for NextGen Precision Health are these, and it covers a lot of territory: cancer, neuroscience, cardiovascular and metabolic, which is obviously a big area, population health, and then emerging areas has ended up being uh, uh, virology, influenza. We're flipping to COVID in a lot of that research, immunopathogenesis of disease, and targeted immunotherapy is a big focus here. And we have assigned faculty research leads for each one of these columns. Next slide. And fortunately, there are 6 columns, which just happen to match up with the 6 columns in the quad. So I've sort of think about this as a Greek structure with improving health outcomes for Missourians in the world as our goal. And how do we do that in those different areas? Well, we need to have the infrastructure of our MU campuses. We have to have the infrastructure in our laboratories, imaging, electron microscopy, clinical translational science unit, a good manufacturing practice facility, which is going to be in this building. We have to have amazing partnerships with industry, government, regional groups, and philanthropy. We have to have a very good tech transfer operation so that we can take ideas to patent them and to and commercialization. And then we need to be able to handle big data, health informatics data and bioinformatics, or genomic and proteomics data. And all of those are necessary in order to feed into these columns. Next slide. So what's new with NextGen? This is a brand new logo. There had been a few logos that have been tossed around, and we've decided on this one. And it's we've taken off the word I, Institute, so it's NextGen Precision Health. And that is the name of this initiative. I mentioned we have faculty research leads, and I've been working with them since I arrived in May, and we are determining who are the first wave of scientists that are going to be in this building. And I sort of took pictures from some of the astronaut corps in the 90s and early 2000s, and we're going to name these first group of next-gen scientists in the next month, and maybe we'll get them some astronaut suits or something. We'll definitely get a group picture. So that's very exciting. I told you we have plans to make this clinical translational science unit in the building, and Dr. Choi and his team have raised $36.5 million so far to go towards the cost of the building. We're going to start a NextGen Precision Health Discovery Education Seminar Series that will be available to everyone throughout the state, and you'll be able to tune into those, and I'm hoping to get those off the ground by January. Next slide. So the topping off ceremony happened in June. This building is going to be complete October 19th, 2021, not a day later. And amazingly, even with COVID, the building is on time and on budget. It actually looks a little further along than this picture now. It's got all the glasses up throughout the whole structure, so we'll have to get a better picture there. Next slide. I'm not going to belabor this because Dr. Zweig already talked about how busy we've been recruiting new talent to the University of Missouri, and he's mentioned a few of these people already. Dr. Sherwin and Yolsu, who came from Kentucky, are amazing researchers in immunopathogenesis and targeted immunotherapy. Dr. Anderson is a world-class radiation pharmaceutical sentist. And her husband is Barry Edwards as part of the team. Brett Frolinger looks at addiction. And then on the important leadership side, Jackie Lewis is our new vice chancellor for advancement. She just joined us from University of Maryland, and she's going to be great. So she's running the entire advancement shop. And then we also hired Nikki Magruder at MUHC as our new director of diversity. You know, we had a diversity leader for the School of Medicine, Laura Henderson, but we didn't have one for MUHC. So now they're a powerful team. We have a new head of quality control arriving from Utah, and Dr. Zweig has already mentioned Russ Waitman. Next slide. So final sum up of me. So I've already said I'm a Missourian. I have very strong ties in Kansas City, St. Louis, and now Columbia. I'm a Royals fan. Sorry, Cardinals fans, but I gave up the Cardinals when I went to Kansas City when I was 18. What a lot of people don't know, I spent a lot of time in the Air Force, active duty, and then retired, and then reserve. So I'm a retired lieutenant colonel from the Air Force. I spent my entire career at public universities and public institutions. And I really believe that the state universities are the crown jewel of education in the USA, a quote from Jonathan Cole. Every component of academic health centers that I've been involved with, my teams have been successful in becoming nationally prominent. And I believe that Dr. Zweig and I and all of his team will do the same for MU and elevate the health system at medical school and the academic enterprise to real national prominence. And I want to be part of the leadership team that's going to lead us to this national prominence. And I think that's it, Dr. Zweig and Dr. Fowler. So just again, thank you so much for inviting me to be part of this alumni event. And I'll just let you consider me an adopted University of Missouri med school grad, even though it was in Kansas City.
Thank you so much, Dr. Barron. I'm again seeing no questions in the chat. I don't know if anyone has any, but someone is saying go Royals along with
that's good.
Dr. Barron. So you haven't made everyone an enemy yet. So, if there are no questions, I do think that Ben has that lovely video of the graduates, if we would want to close with that.
That'd be nice.
I did see one question pop up.
Oh, intention. Okay, yeah, I can answer that one. That is right up my alley. Is there intention to apply for an NIH CTSA award for the NextGen Center? Wow, what a great question. So in Kansas, I spent a lot of time with a big team we created, and we got an NIH CTSA award. There's clinical translational science awards. There are huge infrastructure awards that are awarded to academic healthcare centers to advance clinical translational research. They're minimum of $5 million a year. I think WashU's is more like $10 million a year. Amazingly, we got one at KU through a lot of hard work. We're not ready to go out on our own yet to get one here. That is my aspiration. Instead, what we're doing now is we're partnering with WashU. So we are a full partner in the WashU CTSA. And Dr. Fay, the Senior Associate Dean for Research, and I talked to the leaders of the WashU CTSA frequently. We were on the phone today, and we are going to benefit from being part of their grant, and they'll help us and we'll help them. We have strengths in both areas. And then maybe in 5 years after that grant, after the WashU grant cycle is done, maybe we'll apply for our own. That's I think the plan. So thanks for asking that question.
Thank you so much. Again, I think that many of you are going to go to smaller groups meetings for your class reunions. If there are no further questions, I'll give Dr. Zweig a chance for closing remarks, and then maybe Ben can close us out with that video of graduation.
Yeah, just great to have you all here, and thanks again, Mary and Rick. And I hope that you all will join your reunion groups if you're a member of one of the groups. And please contact us, give us feedback, give us your ideas, and thanks for all your support. Ben? Please repeat after me. At the time of being admitted as a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity.
I solemnly pledge to dedicate my life to the service of humanity.
The health and well-being
of my patient
will be my first consideration.
I will respect
the autonomy and dignity
of my patient.
I will maintain
the utmost respect
for human life.
I will not permit
considerations of age,
disease or disability,
creed, ethnic origin, gender,
nationality, political affiliation,
race, sexual orientation,
social standing, or any other factor
to intervene between my duty and my patient.
I will respect the secrets confided in me even after the patient has died.
I will practice my profession with conscience and dignity in accordance with good medical practice.
I will foster
the honor and noble traditions
of the medical profession.
I will give to my teachers,
colleagues, and students
the respect and gratitude that is their due.
I will share my medical knowledge
for the benefit of the patient
and the advancement of healthcare.
I will attend to my own health,
well-being, and abilities
in order to provide care of the highest standard.
I will not use my medical knowledge to violate human rights
and civil liberties,
even under threat.
Even under threat.
I make these promises.
I make these promises
solemnly,
freely.
And upon my honor.
Thanks again, everyone. I hope you all have a great weekend, and we'll see you all later.
Bye.
Thanks, Mary.
Thank you, Mary.
Good night.